Hey guys, Dr. Ware checking in from Levine Veterinary Center. We have covered a bunch of basic topics for both cats and dogs, and I think we kind of wanted to shift gears a little bit for the next few videos and talk about some more specific disease processes that exist between dogs and cats, and I guess more specifically things that can happen in this area of Arizona too. So today we're going to talk about tick fever. It's actually a bacterial infection that's transmitted from ticks, specifically a tick that we see here in Arizona called the brown dog tick. It's getting more humid this time, and so the incidence of ticks are going up, and so that is one of the diseases that can be spread from that tick directly. Let's see, some of the common clinical signs that we see as a result of this illness. Probably the most common thing, it's kind of a weird one, we see bloody noses. And that's because that bacteria can affect the platelets, not only the number of platelets, but also the function of platelets that are involved in clotting. And so bleeding for extended periods of time from the gums, from the nose, from simple cuts that just continue to bleed, that's a really common finding that we have. Also can cause joint pain, recurrent fevers, affect their appetite and cause just lethargy and malaise. So these dogs they don't feel good, they feel sick to their stomach, they're just not doing well. The disease is treatable, okay, but it can get very, very serious, and unfortunately I have seen dogs pass away from it. A lot of times we treat them with long-acting antibiotics. Sometimes you need anti-inflammatories in addition to that. To reduce just systemic inflammation, and I guess most importantly, this is pretty preventable. You know, there are great products out nowadays that help prevent tick attachment. Well, I shouldn't say tick attachment, but when the ticks do bite, they cause a death of the tick within a certain time frame, and it can actually prevent transmission of that bacteria. So we use one here called Brevecto, and it's a tablet that's, I think the statistic was, and I just read it before this video actually, it's over 93% effective against this tick as far as prevention standpoint. So extremely effective. And it's one tablet and it's given once every 3 months. So from a standpoint of how often you have to give it, it's not really that often, just 4 times a year. So hopefully you enjoyed this portion, and we'll cover a new topic down the line. Thanks so much.